Good morning, students. I am T. Sasikala, Associate Professor of Economics, working in Sri Sarda College for Women. Now I discuss about health economics related to basic concepts. What is health economics? Health and economy are closely linked. A healthy population is here to create strong economy. Health is a state of complete physical, mental, emotional, spiritual, and social well being, and not merely the absence of diseases or infirmity. The above statement, any one of the factor is absence that person to occur disease. According to Adam Smith, economics is the study of wealth. Health economics deals with the following factors such as allocation of resources between various health activities, the quality of resources used in healthcare, the efficiency with which the resources are allocated and used for healthcare purpose, the effects of comprehensive health services on individual and society. It covers the medical industry as a whole and also extend the economic analysis to costing of disease, benefits of health programs, and returns from investments. How best the limited resources be used on preventive, curative, and rehabilitative services to maximize health status of a community. Allocation of financial, physical, and human resources between different activity within a hospital. How to promote the efficiency of the health sector. The purpose of the health economics, the first one is to study the pattern of allocation of budget, effectiveness and efficiency. Second one, to study the health expenditure, vice versa and health status. Third one, evaluation of health services. Fourth one, improve collaboration between different administrations. Last one, to extract maximum benefits from health industry with the least cost combination. The importance of health economics. Health and economic development, planning, finance aspect of health system, health manpower planning and demand analysis, examine the situation where the resources available to us are limited. The alternative use for these resources are unlimited. They promote efficiency and equality in healthcare sector by providing analytical techniques to decision makers. Organization of healthcare investment. These are related to important factors of health economics. Terminologies in health economics. Gross net product GNP is the gross income generated within the country and income received from abroad. GDP, gross domestic product, it is the gross income generated within country excluding money from abroad. Area of health economics. Cost of healthcare. Cost of healthcare include all those services and facilities to promote human well-being. Next one, health problem. The study of health economics also concentrates on health as an important economic indicator of economic development. It deals with the correlation between health industry and economic development. Health is one of the important factors. The healthy people do only in and produce wealth. Demand for healthcare. Demand refers to desire accompanied by ability to pay and willingness to pay for a product or service in a market. The demand for healthcare means the consumer to pay, willing to pay to the physician, this related to that is a service in the market. The demand may be elastic or inelastic. For example, the demand for medicines has inelastic demand as it is necessary product which saves the life. That is the inelastic product. The medicine, all population to depends upon medicine. That is inelastic. Supply analysis in healthcare. Supply refers to anything material or non-material which is offered for sale at a particular level of price and at a given period of time. Supply depends on many factors such as price, cost of production, government policy, demand, etc. The healthcare services like hospital, dispensaries, etc. are all included in the boundary of study of health economics. That is dispensary means related to medical shop, hospital, doctors. This all related to supply analysis. It also explains the supply of medicines, services of nurses, existence of blood bank, lab testing equipment, etc. These all factors related to supply analysis of healthcare. Healthcare services in the market. Market is an economic environment where buyers and sellers of goods and services interact for purchase and sales of mutual benefit. Market is extended forms local to international and covers almost all the goods, both private and public goods and services, which are consumed directly or indirectly. The scope of health economics explains how the market for health services work. Health plans and outlay. Outlay means expenditure. One of the primary motive of every country is to give the primary importance to health services to make citizens healthy both physically and mentally. For that each country prepare its own plan about the possible healthcare programs for human well-being. For example, a percentage of expenditure is given for healthcare industry through the 5-year plans. Financing for healthcare industry. Financing here refers to money invested in healthcare services. Financing means creation and investment of funds in creating various healthcare amenities. Health economic studies the various sources of finance available for health industry. Optimum utilization of resources. The optimum allocation of resources is an important element of health economics. As every investor or facilitator accept maximum benefit within minimum cost. The resources play a major role in deciding the path of progress. The resources in the health industry include all those men and material used for promote the health. The health industry depends upon to spend the minimum cost and to earn maximum profit. This is the optimum utilization of resources. Cost of healthcare. Cost refers to the expenses incurred by producers and produce goods and services. Objectives of costing. To know whether the commodity or service is worth producing at a given cost or not, to ascertain the money value of the product, to forecast whether the particular investment should or should not be made. Forecast means to estimate in future demand, future forecast. To predict the profit of the business concern, to see that whether it is possible to produce within the existing resources, within availability of resources to produce the commodity. To predict the profit, how much profit to earn. These are main objectives of costing. Types of cost. Total cost. The various costs related to healthcare are the money the government spends on healthcare facilities, cost of identifying and treating diseases, cost of equipment, cost of building and other facilities, treatment charges, etc. The sum total of all the cost is known as total cost. It is divided into fixed cost and variable cost. Do not increase due to increase in various function or activities. Example, the fixed cost, for example, cost of building, cost of X-ray machine, etc. Another one is variable cost, vary with amount of service rendered. Example, cost of X-ray films according to number of X-ray taken. This is related to variable cost. Next one, opportunity cost. It is used to describe the loss to the community due to failure to use of available resources, technologies, or institution in the best possible way. That is, opportunity cost means to define to search next best alternative. Capital cost. Capital cost represents expenditure of capital nature. Example, expenses for capital building and machines. Operating cost. These are recurring expenses which are occurring from time to time in running the program. For example, for providing required item in achieving the particular task. That is operating cost. That is a running cost. Another name is called running cost. Next one, marginal cost. The cost of producing extra unit of services, the additional unit of commodity. Demand for healthcare. An individual's demand for good is the various quantities of goods and services that the customer is willing and able to buy at each specific price. The demand for healthcare is derived demand from the demand for health. The demand for health is unlike most of other goods because individuals allocate resources in order to consume and produce health. The healthcare is both a conception of good that yields satisfaction and utility and an investment good which yield satisfaction to consumer indirectly through increase the productivity, fewer sick days and higher wages. The demand for healthcare service is uncertain, irregular, unpredictable. Illness is costly in itself. When a person is ill, he cannot go out for work and losses pay in addition to cost of treatment. That is illness people to occur the diseases, the loss of pay to additional to pay the hospital treatment. These are related to unpredictable situation. Healthcare industry produces some external benefits, that is when the consumer engage in an action it yield the benefits to the third party. Example, immunization, the benefits the recipient as well as society having, they reduce the probability of getting that's diseases. In which economy is a very healthy people, that economy is also known as wealthy economy. Uh, that is a preventive diseases is very important one compare with the disease situation. Government health services are offered at minimal cost, and in some cases the government or private organization agrees to pay the portion or full amount of a bill, which is not true for other services. There is uncertainty regarding the outcome, so the fee given is for the service and not for performance. Strategies. Strategies of health economics. Reducing need for services. Primary and secondary prevention, health promotion and education, patient safely and reduce the medical error, modifying consumer demand, high deductible plans, low monthly premium payment, increase the amount of patient has to pay for care. The health insurance is the most important to the all the patient. That is to pay every month to pay the less amount. And in the situation of diseases and unexpected accident, that insurance helpful to the patient. Progressive cost sharing. Sharing the cost of care by insurer and patient. Modifying provides the behavior. Pay for performance for reimbursement based on the quality of structure, process, and outcome standard of care. Bundled payment. Providing healthcare provider with the cost of healthcare of a patient for the specific episode of the care as a single payment. Instrumental measures. Electronic health record, clinical effectiveness and cost effectiveness research. To conclude that the focus of conventional health economics has been largely on the microeconomic of healthcare. Health economics research around the social determinants of health, especially with the respect of global poverty, inequality, has been rather limited. Health economics is a very important subject to determine the economy is well or not, to helpful to the health economics. Thank you to all.